you doing? It is Stephanie Van Bark of Stephanie Creates, and I am a small business owner. So, and with a new hairstyle, did you notice? It's only going to be up here for a little while. But also, today is going to be a good show for a couple of reasons. First of all, for those of you who know me well and have been watching for a while, this pink and green usually means something. It means I'm going to be talking to someone who is my sorority sister, and I'm very excited to bring her forward. Also, because she's in the health bill, public health to be exact. And I hope I ask her some smart questions because right now we are in a big shift that is probably affecting us individually, but also the industry itself. And I am so excited she's going to be able to come and tell us a little bit more about it. Hello, Dr. Kenyatta.
Hi, Stephanie. Hi, Sarah.
How are you doing?
I'm well. How are you?
Look, did you notice the pink and green theme?
I did, and I was like, do I do the green or do I just like kind of do the pink? But I was like, I'm always gonna be like, I have to put it somewhere. So yes,
Exactly. I am always excited to talk to brilliant women, and in particular, brilliant women in my sorority. So tell us who you are and what you do.
I am Dr. Kenyatta Stevens. I am an infectious disease epidemiologist by training. I worked at CDC for 13 years. I left in 2020 to do independent consulting. So right now I'm doing public health strategy, global health infrastructure strategy across Africa and for state and local government.
Okay, so when I was reading through your bio, it occurred to me, and the medical industry is very interesting to me. Healthcare has so many different layers, and when you're looking at entrepreneurship, you, it's been interesting to learn there's opportunity in that space.
Mm-hmm.
But how do you in public health, when you think public health, you do think CDC, you do think it's connected to, some kind of entity. How do you make money in your space in the public health world? Who's your customer?
So my customer is for me as an epidemiologist or public health has so many different like sub skill sets. So like behavioral health, there's community health, and so epidemiology kind of actually brings all that together. So as an infectious disease epidemiologist, I have consulted with hospitals with infection control. So that's one way. I have worked with state governments, local governments from a public health standpoint, either doing grant reviews, grant writing, program evaluations, helping them to come up with some ideas for their public health infrastructure.
Okay.
Right now, my biggest customer is more so on a global scale, like different
Okay.
countries.
I see you. Yeah. So you decided you wanted to start this business. You
Mhm.
and I were just talking about that startup thing. Is
Mhm.
how do you um first of all decide this is where you're going to go and then start the trajectory of securing clients? What was that like to get into that space and start that journey?
Okay, first let me take my I keep seeing my glare, so I can see I don't need to read anything, so I'm taking my glasses off because it was
Yeah,
okay.
we will make you read it.
So so in 2020, my biggest clients were churches. I work with banks. So like COVID, like how do we like anybody that wanted to stay open? So it's like how do I make this a safe environment? So I had already started my consulting business
Okay.
way before COVID, but it was more so smaller scale. So that's how I really got into the public health and tech side of things. I work with technology companies who had gotten funding from the CDC, but they didn't have public health experience.
Okay.
So
Okay.
I helped them with hiring um, their staff for their contracts, their CDC contracts, and I also helped them to actually write some of the grants. um, public health perspective that they basically needed for
Okay.
safety. So that was way before COVID. So when COVID hit, and it's like, okay, city governments, everybody was reaching out to me for help.
Mm-hmm.
And I would do a lot of career days at like schools around Atlanta, well, actually around Georgia. And so I was getting calls because they were like, hey, so and so wants to know from the school. So the school counselors and the teachers who invited me for career day was like, this commissioner is looking for you. This person, this
Okay.
looking for you because you're the only epidemiologist that they know. So epidemiology kind of blew up
Right.
because when I would go to a career day prior to 2020 and I would ask kids like, do you know what an epidemiologist is? And they'd be like, no. And then this one guy, one little boy, he was like epidemi. So he's like trying to use like his root words. And he was
Right.
like, epidemiologist. And he's like, she works with demons. And he just
Oh
laughed.
no!
And I was screaming. That's like wrong root word. Wrong root, root word.
What I do?
That's not what I do.
Oh, get that out of the world.
So but now when I do career days and I go in, like I went to my high school, my alma mater, and I was like, do y'all know what an epidemiologist does? And they was like, oh yeah, it was like second nature. So everything has basically shifted
Right.
since the pandemic, but also it has increased because I'm also an adjunct professor of public health. I teach
Okay.
lots of public health programs. So at the start of the pandemic, we were getting people from Disney, from cruise lines, like students who worked there, because these companies were like, okay, we need to have workers with public health backgrounds and experiences
Right.
working for us. And
Right.
in that same token, those were some of the companies that I was consulting for, like Netflix and
Oh,
some like
interesting.
Live Nation, like when they wanted to have concerts, like how do I make this safe? Churches, like I want to have a 3-day revival in the midst of this
Mm-hmm.
pandemic. How do I make that safe? And so that's when I would go in and like say, okay, I need to look at your space. There are so many things that go into it. And I would say, okay, this is how you need to set up the room. This is how this needs to go. These people you need to separate this out. We need to make sure it's controlled. We know who's coming in. So you're going to have to register. So you just can't open the doors and have people to come in. We need to get some information on them because, God forbid,
There's an outbreak.
type of something, we can still reach out. So it was our way of contact tracing. And so luckily these clients that I work with, they didn't have like any incidences of like COVID infection or any outbreaks. So like happy with that. And it was funny because some of the artists that would come to these events, they was like, dang, that church really had everything on lock. And I was like cackling what I was like reading. They were like posting. And I was like, yep, that was me.
You got to look. I got it. But it looks like during COVID, actually, that was a really good opportunity for you to
That
show
was
what you could
turning
do
point.
and really excel in advance.
Exactly. And also, even with like flu outbreaks, when we had like, there was one church that reached out to me and was like, hey, we know the flu is bad. Like, we have a lot of members that are sick. Like, what can I do? So right before COVID, like even with the flu, churches were still reaching out to me, not in the same manner that like during the pandemic it was like, hey, can you jump on a call, like call email
Right.
in the situation. But just saying like, hey, what can we do for the church? And I'm like, when was the last time you cleaned your air conditioning ducts, things like that, because those are like one church was like, our ducts haven't been cleaned in 20 years. I was like, that's why people are sick.
Right. Exactly. I was in a workspace just like that.
Yeah.
Old building, and just in this corner, we all got sick because just with the air blowing down on us. Yeah.
Absolutely. And so also with schools, so I was on the medical advisory board for the Cobb County Public Schools.
Okay.
So they actually won an award because they had the lowest cases of COVID in Georgia. Well, even in the nation. And so they had like a whole write-up, but that's when you have to take into consideration. It's not just about opening a school, or it's not just thinking about one aspect. You have to look at it from every view, especially when it comes to minority children, because they have the highest rates of asthma and
Mhm.
other comorbidities at such young ages. And then when you factor in the teachers, so there's you have to approach it from the teacher perspective and the student perspective. And a lot of that was left out when schools reopened, which caused, you know,
Everything.
and get sick. So
Well, so look, let's get into it because I'm really intrigued by last show. I spoke to a gentleman in shipping, and we talked a lot about tariffs because we've seen some of the impact. Now, just this week we're seeing that this administration is, in my mind, going crazy.
mhm.
So, which from a patient point of view is quite terrifying. But I can only imagine from a small business point of view, there's a shift that's happening that's out of your control. So let's talk first about your customers.
Mhm.
How has a lot of this shift, the lack of funding, the change of administration, the shift on our direction, I almost feel like we're going back to the days of polio, where
Yeah,
just like,
yeah.
how has this affected your customers? What are they doing to adapt? And therefore, the same for you.
I will tell you, it's a very bad cycle. So my customers, I work with a lot of nonprofits as well that depended on grant funding to survive.
Right.
And so they have had to let go most of their staff because the funding has ended.
Mm-hmm.
And in turn, so now the staff is put back into this pool of unemployment
Mm-hmm.
and with
Insurance.
no insurance and all the things. And so they're now, so now you have like a different pool of people who have beyond just the high school education. Because normally when you have like the job fairs, it's like,
Mhm.
okay, if you have a high school diploma. So now you have people that not only have 4-year degrees, they have advanced degrees. And so
Right.
everybody's in the same pool looking for the same jobs.
Mm-hmm.
So
Absolutely.
I spoke to some recent graduates um, at Michigan State University. They graduated with their MPHs. And so that's the one thing that I told them. I was like, the market is saturated. So you're going to have to bring on additional skill sets that separate you
Mm-hmm.
from the
Than
rest
everyone else.
the rest of
Mhm.
the people, because now you are competing with people who came from CDC, who have worked in state governments, who have worked for nonprofits, for
Experience. Uh-huh.
experienced people
And really willing to work for less than what they
that
typically do.
are willing to work for less for because they've been blindsided by
Mm-hmm.
the reduction in the workforce.
Mm-hmm.
And so now these are also the same people that are competing for, like, if they're on unemployment, they're having to, look for jobs, and and in some aspect, they're not even in a position to turn down jobs that are being offered if they are if they're getting unemployment
Right. Right.
and
Right.
other assistance. So now you have a system like unemployment system that's
Gonna
bursting at the
be.
seams. And then I record in December. Me and some colleagues were talking about SNAP, so I ended up doing like this whole production, like with call times and everything to record, talking about SNAP benefits and how important they
Mm-hmm.
are to the community. And then we know with all the cuts to SNAP now, people are going to go hungry.
Mm-hmm. And
So
it's going to affect an audience of people that I don't think they even expected it to affect.
they have not, and
Mm-hmm.
a lot of those people are the ones that are the most recent um, laid off, or
Mm-hmm.
and that's been let go from these government positions, because
Mm-hmm.
the federal government was the largest employer of Black women.
Yes, I saw that. I saw that.
So, Black women, we run the households, we do all the things. So now we're gonna have to, figure out. Well, they're gonna have to figure out, like, how do I make this work? Like, how am I able to take care of my family, or how am
Mm-hmm.
I able to do this if I no longer have access to this level of income?
Right. Right. Now everybody's sort of in survival mode. But
Correct.
we were talking a little bit before, and you talked a little bit about um some of these folks are now saying, how do I get a business started?
Yeah.
Well, as lovely as an idea as that is, and you and I have both been in startup phase.
Yes.
Um, and I almost get it. If you can't get a job anywhere else, you know, while you look and try to see if you can make some kind of money. But realistically, a startup, it's tough to start tomorrow and get a check at the end of the
Yeah.
week. It,
Well,
it,
and it's tough in the public health sector too because it's oversaturated. So
right.
I am a part of the American Public Health Association. So I was elected as a governing counselor. So I um, am one of the ones that were selected to kind of help make decisions about how we are moving public health forward nationally. And so we were in some meetings a few weeks ago, and we were just talking about how we have an annual meeting and how the projection for attendance is low because people can't afford it. So we like, do we have a special um, uh, registration for those, who were had reduction,
Mhm.
who were received risks or whatever from the federal government, and all, because then you have to travel, you have to do all those things that where they can normally go to network.
Right.
That costs money.
Yeah, exactly. Exactly. And especially if you're in a place like where we live, where
Yes,
traffic is insane,
yes,
like gas for that, the
everything.
everything.
But public health was so dependent on grant
Hmm.
funding. So
Hmm.
now there's going to be more. You have more people competing for less money. So if you ever have time to sit down and look at the federal budget and look at the millions and billions of dollars that have been cut related to public health and healthcare, it will make your head spin.
But
So
here's the question. So then what's the pivot? What's
so
yes, you
I
are
was
correct, but how do you pivot at this point since the dollars have been cut
so
significantly?
you're gonna have to go past the U.S. So
Okay.
people. So for me, once I realized in November, like the election outcome, and I'm like, so how do I pivot? I'm still pivoting.
Hmm.
Like, so what? Like, how can I still maintain funding? How can I
Hmm.
still maintain my business with everything that I knew? Because I was at the CDC under the first administration with the current president. So I already knew
You
what.
you you got to have a problem. Hmm.
So that's when I switched to international work, like
Okay.
global, because they have a need as well.
And how did you reach out? Because I noticed you have attracted both. How did you make those global connections, or were you kind of already in the pipeline?
So kind of already in the pipeline. So when I worked at CDC, I set up disease surveillance systems in developing countries. So I did international work while I was at CDC. But then also last summer, I had the opportunity of hosting the First Lady of Kenya.
Okay.
She has a nonprofit called Mama Doing Good that's more so about women's empowerment and talking about health. And so as a result of that meeting, I was able to go to the White House state dinner last
Oh,
May. Um,
right,
so it was like the Kenya state dinner where all the people,
right,
you
right,
know,
right.
networking and talking to
I
people
was
and
there.
telling them what I do and that. So
Right.
that opened up the door for me, which opened up me talking with multiple countries. I have some business partners that we all like kind of came together. I'm the public health
Right.
strategist of the business side. Like everybody kind of brings something. I'm also kind of the data and I do some of the I'm do most of the data work, and then we have like a tech person. So we had to come there. And I'm like, hey, there's an opportunity.
Hmm.
So spent some time in Ghana in March, saying, okay, how can we do this? So work with the government. So now working, they're like, hey, we want you to come and set up and help us build hospitals, clinics, and some schools.
Nice.
So I'm like,
Nice.
okay. I spoke at a conference there in Ghana in March as well. And there were government officials from other African countries that came, and they were like, hey, come to our country. We want
Right.
to hear more about this. So that's how I was able to pivot more quickly
Okay.
than most people, because I was already setting myself up like, I
Mhm.
need to reach out to these people. I need to make these connections. But even if I didn't, there are international conferences that are related to public health that, if you are in the public health space and you want to start consulting or start your own business, like that will be the way to go, because you bring a level of experience too that most people in other countries wouldn't have. So like even I don't even remember the year. Like I spent time in Madrid and I taught at the University of Europe. They wanted an English speaking professor to come and do a like a 2-week public health course.
Okay, nice.
So things like that, like utilize your degree. It doesn't have to necessarily be as a public health practitioner role. Get
Right.
into so my recommendation is try to get into more of the professor roles, get some teaching roles, because
Okay.
they do have funding, universities. Now, more of the research institutions, I'm also still a student. I'm a Master's of Divinity student
Right.
at Candler School of Theology at Emory University. And a lot of funding, Emory lost a lot of funding as well because it's a research institution. It also has Rollins School of Public Health. So
Right.
there's a lot of pivoting that's going on with schools of public health as well. But there are also opportunities for those to like say, hey, if you ever thought about teaching, that's a way.
Exactly.
Put in some courses on LinkedIn, like find a way to utilize, if you have a specific skill set or niche in public health that most people don't have, utilize that to make money off of it. Put it on Coursera, put it
Mhm.
on LinkedIn, like
Right. Exactly.
um, type sites, so that you can still make money, write a book about your experience, because
Right.
everybody people are like, hey, when is your book coming out? I say, I never said I was writing a book. It's gonna be
Where
out
did you get that
by
from?
I was like, a book? Who's writing a book? Writing a book.
I had somebody reach out to me to tell me they would write a book for me. I was like,
Yeah.
okay.
It's like it's all the things, but also if you are a public health practitioner and you have the epi experience or the biostats experience, so you can translate that into the regular business market with data science.
But if you are trying to translate it into some kind of training, um, where's the jobs? You know what I mean? So, like, meaning, I would imagine at this point, and it'd be interesting to see how many young people are now going into the public health field, because at the end of this, it doesn't seem like there's going to be anywhere for them to work. So I was talking to a police officer the other day, and he said the same thing. Young people don't want to do anything around police. What they all seem to want to do is this, like the
Yes.
podcast, media, digital media, the whole nine yards. So it's also in a hyper, very um, oversaturated
Hmm.
market. But how are you training those who fear they won't get a job? Well, how do you attract them back?
So it has to be a and plus.
Okay.
So public health and something
Or
plus
something else.
something.
Okay. Okay. A
So
certification and specialty in something.
yeah, so like I do data science. Like so learn the SAS, learn SPSS, learn R, learn Python, all of those things. So now you are an EPI plus a data scientist, because
Okay.
as an EPI, you have to do a lot of the programming work. If you're we were I and when I started, we were writing code for like our data analysis work.
Okay.
And so and that kind of took me more so to the tech field
It
too.
gave you a route. Okay.
So as a part of my public health career, I was working with like designers, like we were looking at software development, like things like that, where we bring them in, they don't know public health, but they need to build this system.
Right. Right. So that is a way to really.
That is an alternative, because it's like, okay, go to these tech companies, software designers, they're still working for these public health entities, and they're going to need somebody to help them pitch
Those concepts.
those
Right.
concepts.
Okay. Good idea. Good idea.
Yeah,
Very good ideas, by the way.
yeah.
Especially in this industry. Um, so now, one of the things I noticed in your bio also is that a lot of your work definitely is directly and indirectly connected to the community.
Mhm.
Um, we're very clear that, all communities are going to be impacted by a lot of these decisions. Obviously, and definitely communities of color,
Correct.
especially African Americans,
Mhm.
women, just the like. It's going to impact, people who are, economically poor, just to
Yeah.
be real honest. Um, it feels like only the wealthy may get out of this unscathed. So how are you able to work within the system that we currently have to elevate um, the importance of public health, or are you having to go around your traditional methods?
So I have stepped out of my comfort zone. I will say that.
Mhm.
I have slipped into into the policy aspect of public health. So there is a subspecialty of public health called public health policy. So public health undergirds everything.
Okay.
The decisions for hospitals, for clinics, for pharmaceuticals, for everything. And so I was able to be a fellow in the Georgia Women's Policy Institute with the YWCA. And with that, I learned how to write policy.
Okay.
So
Okay.
me and my team, my cohort, we drafted a maternal health bill policy for the Georgia Senate.
Okay.
That was when we got some of the senators to support our bill. It didn't go far because, hey, maternal health, and I'm just learning that people just don't like women, and there's not even a color associated with it. So let's just call it what it is. But maternal health
They
is an
don't
issue.
we
So
get
that's,
worthy.
those are things that are policy. When you look at food insecurity,
Hmm.
everything,
Hmm.
especially those in rural areas. And so with the closings of hospitals, the closing of like the CVS pharmacies, the Walgreens, which were some of the only quote unquote clinical spaces in these small towns. So it impacts everybody. There's no color associated with that.
Hmm.
So now that I am, and then as a governing counselor for APHA, it's like, hey, what policy? I have the opportunity to write policies to go to the federal government and say, hey, this is what we are pushing. This is what I want from the perspective and my experiences for those who look like me.
And how realistic is it that that might happen, eh, considering this administration and considering the choices that have been made thus far?
So I will say the same thing, and it's kind of surreal because I always said like I had like I would was doing like a weekly show for magazine during COVID, and then I was doing like IG lives for like different things, and I always would say nobody's coming to save you. You gotta save yourself.
Hmm.
So I'm back.
Saying the same thing.
The same thing. No one is coming to save you. You have to save yourself,
Mhm.
and you have to fight for your health so that you can live to see another day.
And you know what? You are correct. I am definitely thinking more sustainability these days, and
Mhm.
we've got to think a lot differently because we now know we don't have the support that we're supposed to have.
And,
Um,
and that's the approach that I'm taking for the community health strategies that I'm doing across the nation and even globally.
mhm.
How can you sustain this? Because when you, and especially in looking at African countries, when the NGOs come in and they say, hey, we're going to, put these systems in place, but they're the ones that's actually doing the work. But when they leave, oftentimes
Right.
in the community can't keep that going.
You're right. You can't
So
leave that. You don't leave the foundation.
the foundation. So as communities of color, do it yourself. Say, okay, thank you for coming in here, but we can take it over from here.
Mhm.
Learn the system.
Right.
So
And then,
there's a habit of just sitting by and just letting someone come in to be with their savior complex.
right.
Okay?
Yes. Yes. You're right. You're right. And we don't have the luxury of that these
And we
days,
don't have the luxury of that today.
especially in this country, but it will also impact the rest of the world because
The
but
rest of
for
the
what's
world.
happening in the States,
And the
from
other thing is data. There's no data for our community. So how did COVID like basically ravage these communities? And it's because there's no data. We don't have any data for communities of color. I have been trying to, like, there were grants, people came in, collected data that weren't like a part of the community. Outsiders came in, collected data, and it didn't go anywhere. So me as a public health practitioner in these communities, I'm like, hey, I'm reaching out like, hey, this you received this grant to collect this data. I get access to this data set because I'm trying to do XYZ. They were like, oh, we'll sell it to you. How are you going to sell me data that you were paid to collect?
and I also wonder sometimes, I'm in a community where we were surveyed.
Hmm.
And I also sort of felt like sometimes those surveys were geared to say something in particular, not really truly about what's happening in the view to serve the community. It
And
depends on the organization. I'm not saying that's a thing that everybody does, but some of them I was like, now how exactly is this going to help me?
But you would think with everything that happened during COVID that communities of color would be in a better standing, and we are no better off
I
than
agree.
when COVID started. If not, we're worse off. Truth be told, because a lot of people are suffering from long COVID,
Oh,
the lasting effects of
we
these
have a lot of
the
comor.
comorbidities.
We
Absolutely.
have a lot of them. I mean, I'm relatively healthy, but I do have some issues. But it's very hard to kind of turn that around once you're in sort of. So we've got to start out with a much healthier perception of how we're to live and operate. We got to start with our kids to have them understand the importance of working out regularly and eating right and all those things. So, because once you're in it, it's hard to turn it around.
It's definitely harder to turn it around once you're suffering from it, but it's not impossible.
It's not impossible,
Not
but
impossible.
you definitely have to. Look, I'm about to disclose stuff. I was talking to my doctor about. I need to honestly lose weight, and
Well,
it just
that's America right now. Everybody.
right exactly. I was like, Aaron, but it's
Yeah.
a psychological thing. Like it's a really tough thing. She was like, you might need to go see somebody about that. It's like,
And
and
it's psychological because and I do some like working I am working on some mental health hubs in communities of colors using
Mhm,
churches too. And that's like one of the things, but we are our own worst critic,
mhm,
number one.
mhm.
Number two, the system isn't built for us to
Right.
easily lose weight
Oh yeah.
because being overweight causes other issues that cause you to be dependent on meds.
Yes, that is true. That is very true.
So I always say food is medicine.
Yeah. And
So
it
that
shouldn't be, I read something once and I do agree with this. It shouldn't be our pleasure. It should be necessity. You need
yeah,
to eat to
absolutely.
live. And if we just eat what we need to eat to live and versus making it this
More pleasurable is the
experience.
yeah. And we have turned, especially when Instagram came out, everybody was, what did we see?
Your food, plates, and in our communities, everything we do is centered around food. Everything. Like you can't for you to have a good anything, there's got to be a tables and tables of food going, all
And
around.
that's the result of a slavery mindset. That comes from stem from slavery. So once
Success
again, those are things that we have to overcome and reevaluate because now we are in a place where we don't have to center celebrations
around
around overconsumption of
mm,
anything.
of everything. Yes, I
Yeah,
agree.
yeah.
I agree. So what's next for you? Because I mean, again, I was very impressed to see that you are global. And
Mhm,
that's in the people that I've interviewed. I hadn't seen a lot of folks that have been
mhm,
global. I feel like I know some folks that are doing some things in the global space, and most of those that are doing it well are either from that space, um,
mhm.
trying to make that transition has been challenging for others. So for you to be there, I think is amazing. So what's next? How do you now continue to elevate, continue to scale in this public health space, with the where we are today?
Oh wow. So yes, I have more countries on deck for onboarding. So probably in the next year or so, I will be in the position to hire
Awesome.
people
Very good.
in the global health space because when you're talking about countries, it's not like it's a 2-hour flight. So I would need teams of people for all of the countries that have reached out and said, "Hey, we want you to come in here because we need." A lot of the countries don't have stable public health infrastructure,
Okay.
and that just starts with
Somebody's got to be there every day.
right. And so I'm only one person. And
Mm-hmm.
that was like one of the things that I had to learn. Like I can't be all things to all people.
Mm-hmm.
And so I am solidifying my business so that I'm able to hire other people, being an employer of those who have been displaced from the reduction in the workforce, the rifts in the federal government. Um, I've also been meeting with other, well, I'm not a nonprofit, I'm a for profit, but meeting with some nonprofit entities who had to let go their staff,
Mm-hmm.
especially some of their EPIs, to say, hey, how can I help you to to offer my resources
Mm-hmm.
that I have that I can share. Like, so now share resources, or even saying, like, hey, how can I help you myself?
Mm-hmm.
Um, just to kind of build that community because in times like these, people tend to be more selfish. I'm just being transparent. But this is not the time to be selfish. This is the time to be more community minded and figure out how we can
The
help each
full
other.
resources.
Yes, pool your resources together so
Mhm.
that, you know, I might not be able to charge my hourly rate, to this particular business, but I can do enough to say, hey, I can train you or I can train
Right.
some
Right.
how to do this so that you're able to be sustainable
Right.
in
And
this.
from that, make some connections and be able to market yourself in certain places and spaces.
And so, hey, and then I may get to one of these countries, and because it's not just Africa, it's the Caribbean as well. I always say Africa, but I also have some work in the Caribbean. And
Okay.
so I may say, well, hey, I'm going to submit something. Maybe your nonprofit can be the subcontractor to come
Awesome.
do this
That's
work. So
that's
those are something I'm trying to figure out ways to help my fellow public health practitioners utilize their skills to beyond where we are, because right now America um, is
right.
fractured when it comes to the public health infrastructure.
Or do you have a business plan?
I do have a business plan,
Okay. Do you find
and
it
it
Excel?
changes.
Well, that's yeah, I was gonna say,
It
is it
changes. And I would tell anybody with
Well,
a business, like it has to change because last year this time I wasn't global minded, not at the capacity that I am now.
right.
I
Because there's a shift that forced that kind of
that force
strategy.
that, and you also have to have like insight, listen to your intuition, because I was like how am I like global? Like what it like, and just that fear of the unknown, especially doing it from a business perspective versus working for a large entity such as the federal government.
Mm-hmm.
Like, how do I go in and do this? And it was no different.
Right. Right.
And I had enough um business, I had enough clients to where my business spoke for itself.
Mm-hmm.
And so they were like, okay. And to the point where they were like, oh, well, we've heard about you.
Right.
So,
Right.
yeah, so
So
it wasn't a lot of times you have to, especially going into other countries, you have to prove yourself. But
it wasn't a heavy sale.
it not for me, no. So, or it's a situation where, like, oh, we remember you being here and way back when.
Uh-huh.
And then I'm working for CDC and working with diseases and things on a global nature anyway. And I publish. So I was like, oh, well, you can Google me for this disease, or you can, like I've published that. Like I have it. I'm not just talking about things that
Right.
I do. I've done these things and the work is there, it's published. And it's not a lot that I talk about. Like I don't pull that out of my arsenal unless I have to.
But
But
you have to, as an expert, to demonstrate you're an expert in the field.
and especially during like the pandemic, because everybody came out of the woodwork as a public health practitioner, as an epidemiologist, and like they were trying to argue with me online, and I'm like, so how long have you been doing this? Well, you haven't. You're just pulling information from wherever.
Mhm.
And so
From
like
WebMD, like me, the WebMD doctor.
yeah.
I'm a master at that.
And I had like, so my whole life turned upside down. Like I had to make my page public. Like I had to do all these things. I had to like hire people. So like my brand manager, she was like, "Why you should have 1 million followers. Like all this stuff that you've done all this stuff,
Right.
and this is your competition. This lady is not even in public health. She just started." I was like, but she's telling people what they want to hear. Me, I'm like, don't go to the party because
Right.
you're gonna be patient zero. You are infected. Like, like that's me. Versus, oh, you're gonna be fine, or the conspiracy theorists. Like, I'm not.
Right.
I'm like, no, I can't. And then I told him, I said, and I could back up because public health is my second career. My
Right.
first career, I did breast and cervical cancer research at Emory School of Medicine. I was
Okay.
trained as a molecular geneticist, and I have experience in molecular biology. So
Right.
I know disease down to the cellular level.
Right.
I can
Right.
tell you how the vaccines work. I can tell you how the viruses work. And it's never what anybody wanted to hear. Now it kept them alive.
Absolutely. And
For
and you've got people that have just made up stuff. I remember reading during COVID, some dude, and I can't even tell you what he said his experience was. He was like, just drink hot water. It'll be better. And I was like, okay, I'm not a doctor. And as much as I like to Google medical stuff, this is the need.
It's ridiculous. Like they were like, oh, if you go out in the heat, you won't get infected. It was such ridiculous stuff. And I was frustrated for most of the time.
Right.
And then I would post something and so then like I hate being in front of the camera. So that was like another challenge for me because I'm more behind the scenes. I'm like, I'll do the work, but I don't necessarily
right. All this.
And it was like I was like recording stuff and I was like just posting like just words and it was like minimal interaction. If I posted a video of me, it was like ping, 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 ping. And I was like, they want to see the person that the information is coming from. So I was like, okay, Kenyatta, you're gonna have to just suck it up. You're gonna have to
sit on the camera and have a legitimate conversation with people to say, yes, I'm bringing to the table the information that you need.
And I have been on panels where people have tried me, and I was like, I grew up in Decatur, so I'm like,
wrong person.
Don't let this fool you. I am not. Please don't try me on these people's internet. And it was funny because I never my phone was blowing up because my friends like, please don't do it. You're gonna be trending tomorrow. Just don't go ahead.
I love you. Don't do this.
It was a popular person. She was on reality TV or something, and I was just like, she's about to get it,
right? But she don't know what she's talking about.
She don't know what she's talking about. And so they were like, please, you're gonna be trending for the wrong reasons tomorrow. I was like, well, maybe I can turn around for the right reasons. But I was just like, no, I don't. That's the first thing from my mind. But yeah, it got wild.
And
And
I
the
can imagine.
crazy thing is, COVID, this new strain, is looking to be worse.
And I think to your point, we're about to get back in some of those conspiracy theories because you know I vehemently remember talking to someone who said they didn't want to get the COVID vaccine because they were worried about you know being able to procreate or
Mhm.
fertile, to be
Yeah.
fertile. And I had a niece that asked me the same thing too. And I was like, where are you getting this information from? If you're getting it from social media, consider your source. I need you to go to a John Hopkins medical site or some site that's giving you real sound information before you make a decision that could potentially kill you. So, but I feel like now, and that's been some of the concerns of of my friends who are in the medical field, is there's no sources out there like that you feel like you can trust because we've completely derailed and gotten rid of those sources we can trust.
It's not even just getting rid of the CDC's vaccine panel that basically
But they're
gave
pulling information offline.
they have the information. So now people are like, and then a lot of the publications, like the John Hopkins publication that a lot of people relied on, they just didn't have the subscribers, so it's no longer even live. So a lot
So,
of
like,
the
where am I supposed to go to
publications,
trust? I mean, other than maybe looking at some other countries' information, that may be relevant to what's happening over here. So that's one of the things that's driving them crazy is that
yeah.
we
Well,
are to be
there
at the mercy of a lot of myths.
So the bad thing is, and I'm just going to be honest, the in January the CDC was prohibited from releasing information on diseases to the public.
Mhm.
They still can't. So that's why a lot of websites have been wiped out. A lot of
We don't have
these
anything fully.
these divisions and centers for a lot of these diseases are no longer standing. Like they were shuttered.
Hmm.
So
Hmm.
even, and not just CDC, FDA, NIH.
Hmm.
So you're not going to have those same resources that you had before. And
So
even as an epidemiologist and being a part of these groups, so we meet and we're like, so what are we going to do? So there was this big push to like, okay, we need to go and save all the historical data and put it in a site that can't be hacked or touched or whatever. But then it's like how are we tracking? It's hard for us to even track diseases now because
mhm,
they
mhm.
report to CDC, and the CDC would then put all of that data on the dashboard. Well, that's not there anymore. So if I wanted to travel to New York, I would have to be dependent on New York's
Public health
public health
safety.
site. But
Hmm.
it's not mandated that they publish their data.
Hmm. You
So,
could walk into a huge COVID situation up there and you didn't even know it existed.
and the gag is we have epidemiologists and public health practitioners in Canada that's tracking our data and helping us to
Wow, that's
have other
hilarious.
countries that are trying to help us, because right now we are flying blind.
Uh-huh.
And the other statement that I definitely want to make to everybody is that most people are like, oh, healthcare, medical doctors, their decisions came from CDC and from other public health practitioners or epidemiologists like me. They're not coming up with these policies on their own. That
Right.
came from CDC and those others, those centers and those people. It came from the Vaccine Council.
Right.
That's no longer there.
Right. So they're having to figure out how to find the data to be on top of the supporting their
Well, who is there to vet these vaccines that are now coming out if the vaccine panel is the ACIP panel is gone? Because even though I sat on those calls for the mRNA vaccines for Moderna and Pfizer, one was even on my birthday, but I still sat there. It was like an all day, it was an 8-hour call
Mhm.
with, I was like, I want to see the data for these vaccines so that I could talk about and make recommendations based on facts and not what people were putting online.
Right, right.
And so even though the FDA said, okay, there's enough evidence to vote and pass these vaccines, give them FDA approval, it was the vaccine panel that still had to give the final approval.
Right, 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 right. So we are in a world of hurt.
We don't know what's going on. We're flying blind. And so many people said, "Oh no, we're good." From a no, we're not good.
Mm-hmm.
You haven't heard anything because nothing is being published. That doesn't mean
it's not happening. It just means it's not out there.
The salmonella, like they're not even tracking food that are coming in. I'm like, grow your food if you can. Go to a butcher because you don't know what you're getting now.
Yeah, that's true.
And that's the hardcore truth.
So look, so you got to take care of yourself, people. How can we find you in the future?
So I am, well, my personal page is private, but you can find me at like SAPHE Consulting, SAPHE.
Okay.
Consulting on Instagram. And I'm also on LinkedIn for SAPHE Consulting Group. I have a website at www.saphconsulting.com.
Okay. Thank you so much. I really do appreciate you being here today. And there was people that talked about this was a great conversation. Definitely gonna have you back because you my star.
And things are like y'all have no idea like what's happening behind the scenes that's not being said.
And just like that, maybe those are kind of some of the things that some of these nonprofits that are in the health space could start to do is sort of take on the role of the CDC. I mean, I know it's hard and it's easy to just say that, but you know, I've been putting my head in the sand, to be honest with you, because I think it's imperative to think about it. Because I'm firmly entrenched and fully understand that we are about to be in a world of hurt. But I think if I just put my head in the sand and go away,
it's not. One morning and they're going to be like, "Oh, people are dying," because now they're debating whether or not we need to start back masking up, but it's not being talked about.
Okay.
I'm just going to leave that there.
Okay. Look, I will be wearing a mask soon, though. Thank you very much.
I still wear my mask on planes, airports, any places like that because I'm like,
just in case.
Something I did before anyway. So I always kept my face covered on planes. But yeah, because now measles, all the things. Go and see if you need to get a booster for measles.
Okay, good point.
Yes.
Good point. Good point. I have a good way. Oh, side note. Now then we're gonna finish. But my pharmacist actually is really good about that. She, you know, she is in Publix, and when you walk through, it's kind of like the neighborhood pharmacist. So, like, you know, have you had your such and such? Have you done your this, that, and other? And I'm like, I don't like her. You know, I don't even have to remember when I need to do another one. So find yourself a pharmacist too. That has got that kind of support.
And find your source of truth. My followers have been begging me to start. Y'all, it takes more than a notion because I don't take myself seriously when I'm recording videos. I feel like I'm talking to myself.
Right. No, but I mean, you're right. You are correct because this is where people are getting their information. And so if there's somebody that's telling the truth, hold on to them for dear life. You may not be what you want to hear, but it's what you need to hear.
Absolutely.
Well, thank you so much. And I appreciate you. And, you know, because I learned a lot, even not just about your business, but also about what I should be doing as a person.
Global.
Exactly. I was thinking that. I was like, it's a different industry, but let's think about it.
And living abroad isn't a bad thing. And we just think that America is the end all be all, and it's not.
Yes, I agree. Well, thank you so much. You have a good evening.
Thank you. You too. Bye.
Bye-bye. So thank you everyone for tuning in today. I told you this was going to be a good session because it's so important right now. And from her mouth to you, we need to take care of ourselves and really take our health into our own hands because it's not the concern of those who are supposed to be taking care of us anymore. So, at any rate, be back here next Thursday. We will have another show at 5:30. I'm looking forward to talking to each one of you, and I will talk to you soon. Let's see if I can do my little. Bye, y'all.